What if AI could help emergency responders make split-second decisions that save lives during disasters? And what if that same technology could be used in healthcare to identify which patients desperately need care before it's too late? Hello, you are listening to Where What If Becomes What's Next from Carnegie Mellon University, where we ask the bold questions that become innovations for the betterment of humanity. I'm your host, Randy Scott, and in this episode, we're exploring how AI is helping humans make better decisions in response to natural disasters and healthcare crises. This past year has been a stark reminder of how quickly disaster can strike and how devastating the consequences can be. From the Los Angeles wildfires that raged for weeks in January to the catastrophic flooding in Texas this July, we've witnessed devastating loss of life, the destruction of entire communities, and economic tolls reaching into the hundreds of billions of dollars. But here's the sobering reality. With climate change accelerating, these aren't isolated incidents. They're becoming our new normal. Extreme weather events are increasing in both frequency and severity, presenting communities with unprecedented challenges that require rapid, coordinated responses. Each disaster presents the same critical challenge. How do we make the right decisions quickly when lives and communities are on the line and resources are limited? The same crisis of decision-making under pressure exists in our healthcare system. With aging populations, chronic understaffing, and growing demand for services, healthcare providers face impossible choices daily. Which patients need immediate attention, how to allocate scarce resources, and how to reach vulnerable populations before problems become emergencies. In maternal health alone, the United States has the worst maternal mortality rate among developed nations, 7 times higher than other developed countries. These aren't just statistics. They represent communities struggling with life and death decisions where every choice matters. Today, we're exploring how artificial intelligence might help us navigate these seemingly impossible decisions. Our guest is Aarti Singh, a professor in the Machine Learning Department at Carnegie Mellon University and the director of the National Science Foundation's AI Institute for Societal Decision-Making, which is focused on exactly this challenge, using AI to improve decision-making in disasters and healthcare. From drones and robots that can rapidly assess damage, find escape routes and assist in search and rescue missions during disasters, to AI systems that help prioritize which patients need urgent care. We'll discover how technology might help us make better choices when the stakes couldn't be higher. We previously spoke with Professor Singh a year ago in Season 1 of our podcast in the episode Robots to the Rescue, AI Revolutionizes Disaster Response. Professor Singh, what is the mission of the AI Institute for Societal Decision-Making?
Its mission is really to think about how we can use AI to improve decision-making in domains that directly affect society. So the 2 particular cases we are looking at are in public health and disaster management.
So let's first focus on disaster management. How are drones and robots currently being used to help with search and rescue and resource allocation? And how is AI enhancing their capabilities?
The use of robots started in disasters after the 9/11 aftermath. So where we had collapsed buildings and it was unsafe for first responders to go in. And it was realized that if we had robots that were capable of helping with search and rescue, that's a win-win situation. Since then, a lot of the effort has been on using search and rescue robots. There are snake robots designed at CMU that can go inside small spaces. They can crawl in and try to identify trapped victims, maybe potential sources of further damage and so on. But also drones. Drones are easy and inexpensive, and they can be flown over, at least at a higher level, provide an overview of what the building damage might look like. But there are other disasters like hurricanes or wildfires, right, where they can be much more helpful. They can be sent out before it's safe for first responders to go out. Timing is critical, right? So they can provide this early information and a lot of data coming from it.
So these drones and robots, but especially drones, are producing an almost overwhelming amount of images and data, right? Is this where AI comes in to help responders sort through and understand what all this information means?
The way AI is starting to be used, I'll give an example from our institute, is now think about all the data that's coming in from these drones. It's huge data. Even a short 20-minute flight of a drone generates, several hundred very high resolution images, even thousands. And it takes humans a few minutes to process each image. AI can do it very quickly working on the drone image data set. So it can take just a few seconds to do the same task that takes a human a minute. Now, of course, there are many challenges. The accuracy of AI algorithms is still not the same. So that's one of the things we are working on. That goes for if you're trying to look at drone images and identifying if there are victims that are stuck. But there are other tasks you can do. You can look at building damage assessment or road damage or closure assessment, right? And you can use AI to recommend routes, maybe alternate routes that first responders can use.
I'm sure this would be a huge help for first responders. Since we last talked, have you learned anything more about supporting their decision-making with AI?
We have partnered with Florida State University that runs the Florida Division of Emergency Management. And we carried out a tabletop exercise with them this past April, where we were able to work with the first responders and other emergency personnel and really try to understand what are their needs? Where can we best support their decision-making?
What were the emergency managers asking you to help them with? What were their biggest challenges?
The Institute has already been working on building road damage assessment models. It has also been working on resource allocation decisions. These were validated in feedback from the emergency managers and first responders that were part of our tabletop exercise. So they did identify that these damage assessments and resource allocation as the main things. But there were new areas that were mentioned that we had not thought of as much. For example, one thing that has been actually repeatedly mentioned to us with interactions with PEMA also, which is the Pennsylvania Emergency Management Agencies, as well as this tabletop exercise, which was mostly Florida-based, was that they very often have operating plans that are very standard and they are not customized to the specific scenario they may be dealing with. They proposed that we should try to develop AI that can help summarize the information and help customize those standard operating plans quickly and maybe make them more uniform across the different agencies that are using it. So some use of AI in helping support those decisions. And that's one of the things we are starting to think about that we may want to investigate further going next year.
Those operating plans are created and refined before disaster strike, but once disaster hits, like the LA wildfires or Texas flooding, how can AI assist with the split-second, life-critical decisions that need to be made?
There still remains a lot of work to be done to enable something like this. The potential is there because there are lots of data sources that are potentially coming in and things changing over time. And AI has the capability to do that, right? Summarization very quickly and really extract the information that's relevant, send it to the emergency managers. But accountability is again critical. So I think developing first improved algorithms that can actually not hallucinate, that really give the correct information, because during a disaster, sometimes there's a lot of misinformation. People posting things online that could potentially be relevant. It's an observation of maybe somebody stuck somewhere, or maybe a break somewhere in the, dams or levees, I should say. But how to make sure that that information is correct, right, and is valid, and then that an emergency manager can trust it, requires really close-knit development with them, where they are familiar of the AI's shortcomings, they are trained well in it, and the AI is tested also in the real space. So I think the real deployment still requires, a lot of effort to get it in the hands of emergency managers in a real-time manner.
And the Institute has taken a huge step toward that end. Its partner, Texas A&M University, recently released a breakthrough technology known as the CLARKE System, developed by world-renowned disaster robotics expert Professor Robin Murphy and a team of researchers. This AI-powered tool transforms drone footage into detailed damage assessments with remarkable speed, analyzing a neighborhood of 2,000 homes in just 7 minutes, compared to the hours or days it would typically take the traditional way. And not only does CLARKE quickly assess the damage from a disaster, it also tells responders how to get around the damage, providing routes to avoid blocked roads, which is potentially life-saving information when every second counts for search and rescue. CLARKE, which has been 3 years in the making, stands for Computer Vision and Learning for Analysis of Roads and Key Edifices, and was funded by the National Science Foundation through the AI Institute for Societal Decision Making. Aarti, what makes the CLARKE system a game changer? Drones have been recording damage from disasters for several years now. Weren't they already feeding enough images and data for AI to help make useful assessments for responders?
The main challenge there was this data is not labeled. An AI algorithm, when you develop it, requires labeled data, which means that you need to be able to say, here's a building is so much damage, or here's an image which has, a person that's a victim there that needs to be rescued. And such labeled data does not exist. We have tons of data used to train AI algorithms that can say in an image, is there, a cat, a dog, humans under natural circumstances, but we don't have data from disasters that's labeled. So one of the first things this required was actually working to generate data sets that are labeled and large amounts of data sets, because machine learning algorithms typically require much more data.
Okay, so the core problem was that AI couldn't understand what it was looking at in all the disaster footage provided by the drones. How did you develop the labeled data sets for the CLARKE system?
So we assembled across 10 different disasters, drone footage coming from them. And these are, I believe they're all hurricane-based footages, and got them labeled image by image. And it was a crowdsourcing effort, really. In fact, it turned into a nice outreach activity where some of our high school partners also got involved. Some of the students were able to look at these images and label buildings, about how damaged they seem to be. But also then they were validated with some more gold standard labels obtained from the people who are doing this on a regular basis. And that's how the system was actually then trained and developed, taking data. And actually that data set is now released. It's publicly available for others to look at, which is collection of the video footage, which itself was unique, getting it from 10 different hurricanes together, but also the corresponding labels for it, which can be used to train these machine learning algorithms.
Okay, will the CLARKE system continue to get smarter as it processes data from new disasters?
Yes. In fact, this particular system was in its preliminary stages, was actually already used to analyze some of the data from Hurricane Helene and Hurricane Debbie last year. And then we also presented it at the tabletop exercise we did in Florida earlier this year, and really got positive feedback. We were a little concerned that people would be apprehensive of using AI, but actually disaster managers are very used to technology that can help them, but also can potentially fail, right? Think of weather models. They are many times wrong, but overall they do help. So they are used to such technology and actually wanted more of it. So the feedback we got from them was not only did they give feedback in terms of improving the system, they actually said that training people on using it properly is key. And that really got us motivated into we should be conducting training around this.
So it's both. First, you have to train the AI to understand the data, and then train the humans to understand the AI. Have you started training disaster managers on CLARKE?
In June of this year, we did our first training of the CLARKE system with emergency managers. And there were, I believe, upward of 60 participants that joined from 38 different local, state, and federal agencies, as well as I think there were 8 private companies that showed up and did the training for them so that they can understand how to use it, what does it mean when it says something, how much to trust it, and so on.
In both the Texas flooding and the LA wildfires, there were breakdowns in warning systems that contributed to the disaster. Some people never received alerts. Some couldn't afford the cell phone technology. Others didn't understand the severity of the warnings. Is your institute working on using AI to improve these warning systems?
Where AI can help is, one, develop the situational awareness so that these warnings can be made in advance. And 2 is, can AI help craft the messaging so that it appeals to the people who are receiving it? Different people are, as you mentioned, right, some are living in low economic neighborhoods, right? Maybe don't have the same sort of access, maybe don't have the same perception. Again, people in areas that may not have experienced a disaster before versus that have. So what we are trying to do there is actually look at doing initial, just surveys and trying to see how people respond to different messaging around a disaster, and then trying to see whether we can get AI to understand it. So that's something we are looking at. How can we communicate risk that's a little bit more personalized to the circumstances of the people?
With FEMA and other agencies facing budget cuts, Can the CLARKE system and AI help bridge that gap, allowing us to do more with less in public safety?
Yes, definitely. So I think given that the resources are going to be even more constrained in terms of what these first responders will have access to, anything we can do to simplify their decision making, use AI for it. Again, once developed, this AI is relatively inexpensive to deploy. So that's where I think some of the great potential lies, that we can augment their capability and enable them to do the work that they are doing with less resources.
This seems like the perfect place to take a quick break. And when we come back, we're going to talk with Professor Singh about AI's role in helping make vital healthcare decisions for at-risk populations.
This podcast is brought to you by Carnegie Mellon University. Located in Pittsburgh, Pennsylvania, CMU is a private, international research university, consistently ranked among the top universities in the world. Its trailblazing research is focused on creating, defining, and accelerating the future of artificial intelligence. For more information, please visit ai.cmu.edu.
Welcome back. You're listening to Where What If Becomes What's Next from Carnegie Mellon University. We're talking with Aarti Singh, a professor in the Machine Learning Department at Carnegie Mellon University and the director of the AI Institute for Societal Decision Making. Now let's shift gears and talk about the other half of your mission, healthcare. How can AI improve decision making around health issues, particularly maternal health?
I would say parallel to the disaster case, we kind of have two major areas we are looking into. One is, again, sort of like resource allocations for public health management, and another is more targeted interventions. So the maternal health falls in the second category.
So why the focus on maternal health specifically? What makes this such a critical issue?
I think initially we got started because we have researchers on our team who were working in this space, who were actually working with a few NGOs that are working to improve maternal health worldwide. But to me, the main thing hit home when I looked at the numbers, even for US. So United States is a developing country, but if you look at where we stand in terms of maternal mortality rates, it is the worst amongst all the developed countries. A patient is like much more, like 7 times, I think is the number, if I remember correctly, the number of maternal deaths that happen in US compared to any other country. That's just shocking to me, frankly. Part of it is because people may not have access to the right resources, maybe because they are living in places where healthcare facilities are a little further away. I think it's primarily aimed towards rural areas and low-income areas where even if the health facilities are close, people may not have the time that they can take out from their jobs or otherwise to go access these facilities. So anything that can be done to get the information maybe a little bit at their fingertips to nudge them that, oh, this is a really important situation right now. You really need to go follow up with a healthcare provider, but also provide general other guidance in cases where that may not be the case.
So AI creates health profiles of the maternal patients, assesses their risks, and then if necessary, recommends targeted interventions from a healthcare worker or sending messages to them directly through an app to take action. Do I have that right?
Yes. Yep. So both interventions and messaging. Intervention in the form of maybe it's a community health care worker that needs to give a call to this patient, or it could be a messaging via an app.
Okay, so has this been tested in the field?
Yes. So the system was deployed in partnership with an NGO in India. And that was specifically not a chat-based system, like text-based, but it was community health workers making calls. The AI was used to prioritize which patients should the call be made first to. And it was shown that relative to a baseline of an ad hoc way that they were doing this earlier, you were actually able to engage the maternal subjects with healthcare services by up to 30% more compared to that baseline if you used AI-driven assignment of the health workers.
Well, that's very promising. Are there plans for a domestic rollout of this idea?
We are trying out working with different state health agencies to explore that idea further. Also, some local NGOs. One of the things that a local organization is interested in is mental health support, because there's prenatal and postnatal depression is a major issue in maternal health. So we are working towards interventions that may be related to recommending some form of mental health intervention, whether it's chatting with a therapist or even joining a support group.
Any way to apply this model to other health issues?
The methodology can be applied much more broadly. We are keeping our focus on maternal health for now, but it's any kind of assessment where you require like profiling the patients, generating a risk profile, and then matching some services or resources to them. One other place where we are looking at something more concrete is decisions that are made, for example, during triage. So a patient comes to a facility, maybe they come to an emergency department. Should they be treated in an outpatient or admitted or maybe transferred to another hospital because you may not have the facilities? Can AI be used to help triage those decisions? So you can think of that as a resource, right? Again, allocation. Where do we have the right resources that can be matched to the incoming patient?
We seem to be at an inflection point where people are increasingly using AI for making personal decisions. Chatbots as therapists for relationship advice, even health guidance. How can your work help make that relationship and decision-making more reliable?
We have had some preliminary conversations about that instead of using an off-the-shelf LLM, which is what people currently do and still rely on it to be their therapist, can we come up with customized, vetted versions of these chatbots? And that's what we are doing even for the maternal health chatbot, but something similar where you can do it for mental health broadly. So a lot of people in the country right now are suffering from it, particularly post-COVID, and of course with all the other uncertainties going on. So there are some companies that we have started initial conversations with that are trying to do this in the mental health space. Instead of relying on an off-the-shelf chatbot, if we can build in the guardrails so that people can get to trust them, right? So that they know when to respond and maybe when not to respond, to know if they have sufficient information to respond. Because the current off-the-shelf chatbots are trained to immediately give a response to a user query, right? But maybe sometimes the chatbot should pause and think about some particular piece of information that may be missing that then informs a better response. So we are working on foundational methods in which how we can improve LLMs using such reasoning.
This raises questions about personal responsibility. We're bombarded with alerts, financial, health, emergency notifications. Is there any chance we're getting too much information? And if we add in AI and chatbots, how do we manage these technologies to make good decisions?
Our job there is to really assess what are the important things, which ones can we trust more, and that requires, again, training and experience with a particular tool that we may be using, getting really familiar with what is this tool exactly supposed to do? Is it matching my goals? Can I trust it? What is the experience of others, right? Very often, people get excited about some product and really try to, tell it to everybody, but without doing the due diligence that, oh, have I used it enough? And do I really trust this before I recommend it? I think is kind of important.
Now, do you think state and local governments are also responsible for helping to ensure safe use of these AI tools for decision-making? Most, if not all, of U.S. states have either introduced or enacted AI-related legislation or policies. And I just saw that at the local level, Allegheny County, where Carnegie Mellon resides, recently implemented its own AI policies and training.
I think it's commendable, but also very important that a lot of agencies start paying attention to this and come up with some policies, directions around how to use AI and how not to use AI. And it was great to see that Allegheny County recently released this. On the positive side, not only did they come up with the policy, they also emphasized where the accountability would lie, which is so crucial, especially in government organizations and government policies that are rolled out, that even if you use an AI tool, it's ultimately the government official who's going to be responsible for whatever policy consequences there are. And they also talked about the importance of training before people in the government use these methods.
Okay, so is there anything missing from these state and local policies?
One thing that I would like to stress is that I found missing from this and some other state AI governance policies are they lack measures of success. They don't track metrics once AI is used, or at least they don't spell it out, of how they will track whether when AI was used, what were the consequences, and is it actually helping at the goal that they set out to? Is it boosting productivity or leading to better policies? How will that be assessed? How will the impact of an AI failure or wrong decision by the official because they relied on the AI, how can that be tracked and mitigated? I think that's really crucial.
How about any new projects you're working on that you're particularly excited about?
Our institute is developing an AI adoption framework. Okay, so that is to say, can we understand under what situations will AI be adopted in a particular use case or not? And what are the control factors that can control whether AI is ultimately there is sustained adoption or is it just early adoption and it fails? So as an example, of course, we need a lot of improvements in AI technical capability, making it robust, more accurate, explainable, transparent to the extent that we can. And all of that leads to greater adoption. But there are societal factors. At the user level, it's privacy concerns, it's accountability. At the organization level, it's operationalizability. How easy is it to integrate AI in their work stream? Legality of the consequences, right? And at the societal level, it's ethics, fairness, and so on. So these are factors that can go against adoption. But by being careful about the way the user, the human AI, back to that part, right? The way the user is using the AI, is it directly accepting the recommendations made by the AI? Is it first making its own decision and then trying to see whether the AI has a correction to offer? Or what is the modality? What does the interchange, the exchange or interaction between the human and AI look like? That can really play a major role in whether the technology, despite all its abilities, succeeds or not under these constraints of user, organizational, and societal factors. So trying to understand this and develop a framework around it is, I think, critical. And that's one of the things that we are also excited to work on.
Let's look ahead, let's say 3 to 5 years. What's your vision for the Institute's impact?
We really want to continue to work with our partners. I think that's our strength because you cannot develop AI that can improve decision-making in real life without involving the stakeholders from the very beginning. And my hope for the 5 years is that we are able to demonstrate in, even if it's just 1 or 2 concrete use cases where AI was adopted and has quantifiably improved the state of the art in decision-making.
Well, that concludes our episode. Thank you to our guest, Professor Aarti Singh, and thanks to you for listening. Please check the show notes where you'll find links to additional resources for this episode. And to learn more or contact us with a story, idea, or comments, please visit cmu.edu/whatsnextpodcast. If you are enjoying this show, please rate and review us on your favorite podcast site and share with friends. And be sure to subscribe so you'll never miss an episode. I'm Randy Scott, and you've been listening to Where What If Becomes What's Next from Carnegie Mellon University, where we are asking the bold questions that become innovations for the betterment of humanity. Stay tuned and stay curious.